Now let's take a closer look at partnering for recovery.
I think, everyone can give some personal experience on this issue. I, as you can tell, don't come from these parts. Most of my experience is from the UK, but I do now live in Vancouver, and moving to Canada was, for me, a really exciting opportunity to see how another country deals with a problem that I was very close to in my previous life in the UK. And I've been thinking a lot recently about what somebody who you may know called Bill Bratton, great police chief from the US, best police chief of his generation. He has this catchphrase that he uses on his Instagram, which is, cops count, police matter. Cops count, police matter. And if I'm being honest with you as an outsider, moving to BC, living in Vancouver, I think about that catchphrase because for drugs and addiction, I've had this sense for a while now that there are lots of people who think the cops don't count and don't matter and aren't part of the solution. And that's very strange for me. I come from a country where we have a policing by consent tradition, where the police are at every committee and every table when some of these issues are being discussed. And my impression, having lived here for a few years, is that they've been asked almost to leave the field of play, that this is purely a health issue, that we need to live with the public safety consequences. And, the arguments, they're probably familiar to you. Police interdiction upstream doesn't work. Busts of dealers and their trafficking networks only increase the value or the violence. Arrests of people in this market are always counterproductive. You've probably heard this a lot. And I think today what I wanted to say was there is, I think, a need now to reassert the role that the police can play in tackling these issues. And I think one of the problems is that the partnership agenda has not been clear enough for the police. People have not been clear about what they need the police to do, those things that only the police can do. And I'll give you an example in the UK of something we tried to do, which I think might be making a difference here. We have a drug overdose crisis in the UK too, as you can imagine, and we, as well as hiring more police across the country and investing more money in treatment, I was talking to people like Keith, talking to people like Carol Black, and I was saying, look, what if we just tried to invest in prevention and treatment and policing, but just in one place? As it turned out, we went to 5 places. We chose 5 locations, towns across England like Hastings and Blackpool and Swansea, places with very high rates of overdose. And the goal here wasn't to say, let's put a bit more money into treatment. It was to say, let's take a whole system approach. Let's tell the police, this is what we need you to do. And the police were given extra resources to focus on the dealers and the traffickers who were flooding these towns with illicit drugs. We gave more money for treatment places in those towns. We gave the police clear direction that they had something to refer people into. And so the project, if you're interested, is called Project ADDA. It stands for Addiction, Diversion, Disruption, Enforcement and Recovery. And the whole point of that was to say, if this works at a local level, maybe we can expand that more broadly. But it proves the point, I think, that these kind of programs can't be single pillar. In the case of ADDA, we've had essentially 3 goals, and they're crucial for the public to have confidence, I think, in the whole system. One is reduce drug deaths. The second is reduce drug crime. And the third is, after you've reduced drug deaths and reduced drug crime, we wanted to see a reduction in drug use. In other words, we're not fatalistic. We want fewer drugs in our communities. We want less drug use in our communities. And we can do better on treatment and recovery. And we can do better on enforcement at the same time. You don't have to make a a choice on that. So those are some of the innovations that I've been involved in, and I think in the context of Alberta, there's a lesson there in terms of using the police in the right way and making sure that they are absolutely at the table and involved in the solution.
Excellent. Thanks, Blair. Let's bring it home to Edmonton, and Dale, put you on the spot. What's happening on recovery here? What is top of mind for you? And I know you've been a major advocate of integrated whole of systems approaches. What comes to mind for you?
Well, I mean, there's lots of things that come to mind. And I think, first of all, as you heard today, whether you're dealing with guns and gangs, whether you're dealing with just about everything we heard, it's about partnerships. And when you talk about addictions, it's obviously very complex. What I really like about a recovery system in relation to the Alberta approach right now is you've got guys like Dr. Humphreys, who you just heard, kind of explaining to you in language that we all understand. You've got guys like Dr. Day, you've got guys, like Blair here, that are on top of this providing oversight. Not political oversight, but operational expertise by subject matter expertise. When you lay that in and you look at in the last few days, and you actually did, and going back to my job before this one as a deputy minister, it's not too often that you can go to any function. On day one, you can get a First Nations chief to come up and tell you about partnerships and reparation and how we got to do it together and how addictions and trauma are driving some of that. You follow by Minister Nixon, who talks about social services, how the role of, getting adequate and effective housing, but also to get the vulnerable taken care of. Today, we have Minister Amory, followed by Minister Williams. Tomorrow, Minister Ellis. And I mean, you've got the Chief of Staff to the Premier, Marshall Smith, here. When you can get that kind of horsepower going in the same direction, good things happen. And I think that's really what I see here right now, because one-dimensional approaches, and I'm tired of trying to be an English teacher to keep up, to be honest with you, with some of this stuff. The reality is everybody's trying to tear apart words, but one-dimensional approaches in this space has never worked. One-dimensional enforcement has not worked. One-dimensional harm reduction has not worked. One-dimensional housing has not worked. And what you're talking about is a system. And unless you get those parts, and then everybody goes to, well, we got to build this, and we got to have infrastructure. It doesn't start with infrastructure, it starts with thinking and people. And the reality is that's the direction we're going. And our province has been good partners for policing, regardless of political stripe, and I'll just say that right now. The reality is they're focusing on giving us a holistic solution that we can actually make better outcomes for our community and for the people in need of the services. My frontline officers, many of which are here today, they have the capacity and the ability to make those decisions. What they don't have right now at times is the support, because they're judged for the wrong reasons when they're actually trying to help people. And honestly, we need to get over ourselves, all of us, ourselves included, and we need to focus on what we can do differently. And I know Chief Dubord will speak eloquently of what's not going well in BC. So, leave our titles behind, leave our personalities behind, and let's get some results. And that's what these individuals stand for. So I'm optimistic.
Love it. So I will, I was going to go to Nathaniel next and ask you about the virtual opioid dependency program, but since you so kindly pointed towards our friends in BC, why don't we jump to you, Neil, and see what's happening there. The BC-Alberta context is just rife with so much misinformation. Give us a sense of what's happening from your perspective. What's working, what's not working?
Well, good afternoon, everyone, to begin with. And, I'm going to start off by actually having you help me out a little bit in the audience, if you don't mind. And I'm not going to have you do push-ups or calisthenics or anything. All I want you to do is raise your hand. And I want everyone who has a son or daughter between the ages of 10 and 59 to stick up your hand. Okay, leave your hands up. And there might be a few people out there, I can't see everyone, but if you don't have a son or daughter between the ages of 10 and 59, if you have an uncle, an aunt, a niece, a nephew, put up your hand now, a friend between 10 and 59. And of course, that's going to include everyone in the room. But the fact is, in BC, over the course of the last year, the primary cause of death between people 10 and 59 was overdose. And that's astonishing, 10 years old when you think about that. And I'm going to build off a little bit of what Professor Humphreys has said, and certainly Minister Williams, and talk a little bit about a whole system approach. But I think it's first important that we start with data. And we've heard lots about evidence-based decision-making here, and let's talk about the data. So over the course of the last 6 months since decriminalization has been in force, or the pilot project has been in place in British Columbia, we've seen 1,455 overdose deaths. That's the highest number we've ever seen. That's just over 6 per day of people dying from overdose deaths. Now, when we talk about more specifically in relation to what we have for beds to be able to assist people, this whole system approach is just so critical, and you're going to see it here because we have one leg, and I think Adam Palmer spoke briefly yesterday about having a 4-legged dog and needing all the legs of the dog. Well, we have only one leg going on, or we've got a piano missing a whole bunch of keys, so whoever's playing the piano certainly isn't going to be able to play the whole song. But when we talk about beds in British Columbia, we have 3,237 beds that are for people that are suffering from co-current diagnosis, either addiction and mental health. We have 100,000 people addicted in British Columbia. It's 3,237 beds and 100,000 people addicted. So there's just no way you can be able to square that when you start to talk about it. And then when we talk about specifically in my health authority area, I have the larger, I work and live in the major health authority area within British Columbia called the Fraser Health Authority. They have 24 detox beds, and it's 2.5 months to get into a detox bed. That's the waiting line right now to be able to get in. So all those people that put up your hand, if you can imagine someone between the ages of 10 and 59 that you know, that picture is in your head right now, imagine that person suffering from an addiction and you having a moment in time, an opportunity to be able to get them into some sort of treatment program, and you have to wait 2.5 months, right? It's unacceptable. These people deserve better. And before I hand over the mic again back to you, Alina, I'll just talk a little bit about the other side of the equation as well, is that without a whole system approach, of course, we're never going to be able to catch up with this. And we've heard lots about that from our panelists here today and from the other experts over the course of the last day and a half. Now, in saying that, our officers are also going to these calls each and every day. And I have never met an officer in my career over 36 years that has not wanted to help people. You know, we want to solve problems. That's what we do very well, is we try to solve problems. I can't imagine going to the same call day after day after day, seeing people in acute crisis, suffering tremendously on our streets, and not being able to help. I can't imagine what that does to our officers, to their morale, to how they serve the community. And I always talk about the investments I make internally with our officers. You know, when they move that externally, that investment I make internally hopefully allows them to provide better service externally. So how do we actually give them an environment where there is hope, where there is the way for us to be able to solve a problem and actually help these people that are in crisis on our streets?